stress has three sources and three powerful solutions, including a powerful shortcut. So I'm going to share that with you today. We're going to be switching screens back and forth a little bit so you can see me and the screen right now, and I can switch it where you will just see the screen, and that's going to be easier for you to see things that are detailed. And sometimes I'll be up in the corner, or I might be all of me. All right, so we'll switch back and forth, so hopefully you'll be able to see everything really well. Tonight I'm going to share with you some awesome solutions. They're going to be really applicable. You can apply these right away. We're not going to get rid of your stress, but we can help your body to manage it better. So stay tuned. First, I'd like to learn a little bit more about you, though. Even though I may not be able to hear you, you can put it in the chat. Maybe we'll see that. But why are you here? What is important? If you're watching this video and it's not live, you can still think through these things. What is important to you? So why are you here? What do you hope to learn? If we go in with an understanding or an intention, a desire to learn something, we're more likely to come away with something, right? And hopefully you'll get some surprises as well, but I want you to have an outcome in mind. Is it to stay active? Is it to stay independent? Stay comfortable, out of pain? Perhaps to save the life of yourself or someone else. And really, it can be a life-saving event when you manage stress better. And not just suicide, but people go on medications because the stress causes health problems. That leads to surgeries or medications. That leads to complications that may then result in diseases and death or just a lot of suffering. So it really can be life-saving if you apply these simple, not always easy, but simple techniques. So I'm going to tell you a little bit about me now. Family chiropractor since how long? It's almost 30 years now, 1996. Family chiropractor, really focusing on helping everybody in the family, including kids and elderly. Because when we focus on the foundations of health problems, then it applies to everybody. And I use these techniques I've learned through chiropractic neurology, which is how to focus on the nervous system and how to rehabilitate it. Things like autism and ADHD and traumatic brain injury to help the body to rehabilitate naturally. And we use functional medicine, which is the next thing there, to help do that, as well as functional neurology. So neurology, we're rehabilitating through particular therapies or exercises, concepts, and functional medicine, we're using nutrition and diet, things like that. And lecturer, a member of the International Association of Interdisciplinary Association of Functional Neurology. So if you can say it 3 times fast, you get to join. Essentially, it is a group of different kinds of providers that get together and look at how we can use functional neurology to help people get well naturally. The reason we get such amazing results in our office is because we have a different approach. It's called salutogenesis, or that's a word that characterizes it. And it comes from a Latin word saluto. So I'll let you look at this up close here. So saluto, which is health, and genesis was creation of. And so no amount of focusing on disease is ever going to teach you how to get healthy. That makes sense, right? You need to focus on, and what I focus on is factors that generate or create health in your body. And when we focus on that, we can get a result of health. But if we focus on disease all the time, we may manage disease better, but we're never going to manage to get health better. And our final one here is synergy. What is that? That's combined effect that's greater than the sum of the separate effects. That's what synergy, the name of our office. Go back here. So that's the name of our office, our logo, Synergy logo. It's multiple factors that contribute to health or disease. And we evaluate for those and we provide solutions for those. We're going to provide you a number of those today, things that you can apply to your own life. Who or what is providing solutions for you? Tonight, I'm going to be providing them for you. But think about this as you manage through the medical system, whether it be online or in doctor's offices or advertisements you see on TV. What is their focus time, money, and effort. We'll consider what your focus is and then what other people's focus is. So time, money, and effort, that leads to an information, product, or service. That makes sense. And we have different people who are involved in this medical system. We have the manufacturer, that's pharmaceutical companies or maybe product manufacturers, doctors, and those may be local doctors, that's what we're really talking about now. Manufacturers have their own doctors or lobbyists, etc. But here we're talking about more local doctors. But it also could consider like the CDC and public health officials. They're not really seeing patients, but they're making policies. They're almost a manufacturer of their own. And then the typical patient or consumer. You are not the typical patient or consumer because you're here listening to this. But we'll talk about what the typical one is looking for. And we're not all that different. The manufacturer, they've got stockholders. People are invested in that. They have to make money. Makes sense. They'd also like to serve mankind. I'm sure they have some good goals. They really would like to do well. But they have to balance that with making money. Doctors, they have management companies they may work for. That's like HMOs that are trying to save money and they're telling doctors what to do or not do. Insurance companies, the same thing. Management can also be their boss. Doctors who work for other doctors or just work for business owners, they have to answer to them. Patient interest. I had a patient recently who said their son worked as a nurse practitioner somewhere, and patients would give reviews, and if they wouldn't give them the new weight loss medication, they would give them a bad review. That's pretty sketchy, right? But the worst part of it is that a nurse practitioner, he is evaluated partly on his reviews by management, so he has to keep up good reviews. Yeah, you can see the problem you're creating here. So now this nurse practitioner is having to shoot himself in the foot to keep from shooting the patient in the foot. And then they have their own money issues, right? They need to pay back their student loans, and they have to take care of their families, put their kids through college, etc. So doctors have all these things to consider. And then the typical consumer, there's time, there's money, there's their immediate health concern or comfort, and they just want to enjoy life. There's all these competing, and they don't have to be competing, but they can be competing interests at time. And one or the other, they're going to come to a solution, and it's going to be serving someone, and we want it to be serving you and your interest primarily. Now, it's great if it can be a win-win, right? I have my own interests, and I have patients, and I want this to be a win-win for us. But we have to consider what's when we're advertised to, especially by manufacturers who are not really our policymakers that aren't really connected so much, don't have to look the consumer in the face. We want to consider what is their motivation? What are they trying to do? All right, now talking a little bit more about you. Who or what is pushing your button, your stress button? There's 3 different options. Basically, we have mental, chemical. Chemical is what you eat, drink, and breathe. And then we have physical. So mental, that's mental, emotional. That's what often people think of as stress. Physical, that's posture, that's exercise or being sedentary, that's accidents or injuries. All these things contribute to stress, and I'll talk to you about how these interact with each other. It's not just this one, or this one. They affect each other, create each other. Nerve irritation really is what we're dealing with here. Nerve irritation causes your symptoms. Often people ask me, is it a nerve issue? It's like, well, if you feel it, it's a nerve issue, right? Nerve is how you perceive anything. So everything that you perceive is a nerve issue. It's involving nerves. And it's nerve irritation that's the primary. There can be nerve damage, but that's nerve irritation. And eventually it can cause nerve death. Essentially, you have a nerve that doesn't work or a nerve that's irritated. And a nerve that doesn't work can have 2 categories too. It can be underfunctional or it can be dead. Underfunctional, we can rehabilitate with functional neurology. Dead, well, sorry. nerve irritation and brain disturbances that can cause pain, it can cause toxicity, it can cause tingling or referred sensation, brain fog. It can make you susceptible to more injury, whether that be mental, chemical, like immunological, or physical, because the nerves have to be able to protect you and they run the whole body, and if the body can't run properly, then you're more susceptible to damage, injury, or disease. So chemical irritation of nerves, that's really the issue, the last step in the puzzle here. But we also have joints, posture, and mental, emotional. These are physical. This is mental, emotional, right? So we have our three again: chemical, physical, mental, emotional, causes of nerve or brain irritation. That's all there is to it. We look at those things. How can we help the body work better? So essentially, we help the nervous system work better. You feel and function better. Conventional model of how things work. So where is their focus on the conventional model? If you look at this model, we actually have genetics, we have body systems and function, and then we have symptoms, right? Those are our three big elements here. Where do you think the focus is of conventional medical treatment? Like, oh, they're working on the body, right? For sure. I mean, we all work on the body, but is that where they start? They do it's a real thorough assessment of the body, and then let's treat the body function. Or are they treating? They can't treat genetics yet, so it's just not that. It's like, oh, well, you have special doctors who are digestive doctors or immune doctors, or there's no detoxification doctor. You might have a bone doctor or a nose doctor, right? So body parts or body system doctors is most of them. They're like, okay, so they're looking at systems. But do they really evaluate that to see, oh, is it working optimally? That's not really where they start. They start at the symptoms. And we're talking about mental disorders or stress today, but it could apply to any symptom or system in your body. So here we're talking about mental, emotional, or neurodegenerative, anxiety, depression, and other named conditions based on body part or body system. Their focus is on the symptoms. They start with that. There's a list. This is the, especially if we're talking about mental, the DSM-4 Diagnostics and Statistics Manual, where they essentially just have a list of symptoms, and then they can give you a name of what you've got based on how many symptoms you have of a particular condition. But it's true also of most of the other diagnostic codes. We call them ICD codes, and essentially it's just a list of symptoms. Do you have it? Sometimes it's a list of lab work or other things that can be measured. Environmental stress. Genetics is your genetic expression. You're not your genetics, but your genetic expression is affected by environmental stress. Okay, what is those environmental stressors? Well, I'll tell you in a minute, but that leads to epigenetic changes. So your genes are modified by environmental stresses to cause epigenetic modifications. Essentially, it's just changing how the genes work. That happens through physical, chemical, and mental. Those three types of stresses we talked about. These are your buttons that people are pushing, right? That affect, in this case, we're not talking about emotional stress. We're talking about physical, chemical, mental, which are environmental stressors that change the expression of genes and make you more susceptible or make you have symptoms eventually, cause dysfunction, cause symptoms. And of course, this is what we're all focused on when patients come to my office. It's like, I have this symptom. They don't come in and say, I have an epigenetic alteration that I need help with. It's about symptoms. That's okay that patients are thinking about that. But if that's all doctors are thinking about and then working backwards, well, that's not going to get to the cause ever, right? That's disease focus, not a wellness focus. When wellness, we're thinking about what's going on here or what's causing this to not work right. So we focus on supporting your environment, physical, chemical, mental, so that you can have a better genetic expression. Who's in control of these systems, your body, this whole body disorder? Because it's not just a single part. Who's in control? What system? This is participation time. Who's in control of your body? What system? Right? Nervous system controls all the other systems in your body. It is the master system. So we look at the cause so that we can change the effects on the system, and we look at how the nervous system works because it's in charge. So look at cause, look at nervous system. Those are the two focuses that we use because those are going to get to the root cause more likely. And we don't have to be so fancy to micromanage or control the body. We don't have to manage the disease. We let the body manage the wellness. So where do you think you should start? Symptoms is upside down on purpose because that seems kind of like an upside down backwards approach. Should we address the cause or should we address the symptoms? And where should we start? Well, I already told you where I start, and I think that's probably, you would agree, that's the place to start. Even though we start talking about this first, we want to understand you, we understand what you're dealing with, the symptoms, but to really address it long term, and naturally we go start down here. And as I mentioned, we treat the nervous system because we can rehabilitate it, help it work better. And part of that treatment is through physical, chemical, mental approaches. In fact, all of it is. And that has an effect on the nervous system, and then the body can help itself. Right? So physical, that may be chiropractic adjustments, that may be specific exercises. With neurodegenerative orders or stress disorders, we may, we'll talk a little bit more about things we can do, but it may be eye exercises, maybe balance exercises, core exercises. So we do these foundational therapies. We do this a lot with people with ADHD, autism, dyslexia, but other people too, if we find problems, work on primitive reflexes. Chemical, super huge. We'll do lab testing. We'll talk about that to look for deficiencies, toxicities, gut health problems. And mental, so we drive right into that, and we'll give you some techniques today. We don't deal a lot with mental, but it's important. It's one of the key factors that's contributing. And we think mental here and here, these mental disorder, but there's also mental causes. And we'll teach you how that's the powerful shortcut we'll give you to come in the backside of the brain before it ever gets out to this side. That's lifestyle. So we'll give you guidance help. We'll teach you what to do. You make lifestyle changes, and we'll help you make those. This is my picture of the brain. It's on a little chalkboard in our office, so I drew this over a couple weekends. There's more of it over here. But this is the brain, and we'll teach you a little bit about different parts of the brain. We're not going to go through all this. Dorsolateral prefrontal cortex. Don't worry, I'm not going to ask you to remember that. What does it do? It's this part of the brain up in the front. This is the thinking part of the brain. Working memory, what is that? That's like if you're having to remember somebody's phone number, and so it says, hey, it's 635-8266, 635-826. It's keeping that in your brain until you go to type it in. That's working memory. Cognitive flexibility, being able to change your mind, planning, you know what that is. Inhibition, stopping yourself from doing something that maybe not in your best interest. Okay, abstract reasoning, thinking about things that are not tangible. Motor planning, that's what your brain does before it actually does a physical action. And organizing thoughts. That's all the dorsolateral prefrontal. And then we have the orbital frontal. Now, the reason we're talking about these parts of the brain is because this is the part where we think, okay, this is who should be in control. This is the adult in the room that should keep my stress and my emotions, and we have this, right? Often when we have stress, mental, emotional stress, we're thinking, or depression or anxiety as it gets worse, or PTSD. It's like, I know I shouldn't be thinking these things, but I am thinking these things, and they're affecting me physiologically. I'm stressing out, I'm sweating, I don't want to go somewhere or do something. It's like, but I should, but I just don't, and I can't overcome this because it's so powerful. So these parts of the brain here are saying, hey, you're good, go for it. And I'll tell you about the other parts in a minute. They're saying, no, I know better. Orbital frontal represents emotion, taste, and smell, and reward in decision making. We want to reward our brain, and we want to reward it with the right things. Everything is rewarding our brain these days, and most of it is rewarding it for the wrong reason and to get us doing things that we don't want to do. Chemically, like with the whole center of the grocery store, all these ultra-processed foods. Mentally, emotionally, that's news stations and social media, games that get that dopamine fix, right? So all these temporary surges of stimulus that in the long run make us not healthy. Cerebellum. Cerebellum is a super important part of the brain. It's underappreciated. It coordinates ongoing processes. We think of it a lot as motion. Like if we're doing this, it keeps me coordinated there when I'm moving or walking, but also coordinates thought processes as they move forward. And if they're not moving forward the way we want to, cerebellum can be part of the problem. In the limbic area. Limbic area, this is the part where this is the guy who really is in control. This one and the next one. Hippocampus, amygdala, cingulate. So limbic is actually a combination of things. These are the deeper parts of the brain. They're the non-conscious parts of the brain. We're not aware of these things. They process memories. Things that happened to us in the past, they come back through this area and have their impact. Attach emotions to memories. How important is this to me, and how is this going to affect my emotions, and then inform these higher frontal parts of my brain to say, hey, this is how you should feel about this. This is what you should be thinking. Suggest emotions, fear, and pain. So this is really, this can be really helpful, or it can be really harmful. And more often it's really harmful when we're having these disorders. So hippocampus, amygdala, and cingulate gyrus. And the temporal lobe is our last one. This is just an honorable mention. Facial recognition, emotion, and auditory processing. So again, emotion is processed there. And the hippocampus, the memory area, is just on the inside of that. We deal with this a lot with autistic kids as well. That facial processing and emotion, all that's doesn't work so well. All right, so that's that. We're going to teach you how to shortcut, how to get into that area of the brain that informs the other areas of the brain, because these when you try techniques, it's like, oh, I'm just going to relax, or I'm just going to think good thoughts. I'm just going to not think that bad thought, or I'm not going to be stressed. I'm just not going to be stressed. I'm not going to be stressed. That's you just saying, hey, I'm going to do this. But this part down here is going, no, I know better. So you feel, this fight goes on in your brain. I'm going to teach you how to come in the back door and get both sides working for you at the same time. It still takes discipline to make the choice, but it gives you a lot more power when you do make the choice. So Anna's going to teach you about this technique. And she's going to do that right now. So come on in, Anna. I'm going to mic her up.
I'm just a little bit shorter than you, so you may not be able to see me.
Okay. So step in there. Yep, you're just right.
There I am.
Okay, we'll turn it down a little bit so I can see more of you. So heart math, so I'll tell you a little bit about this first, and then Anna will go. So this is the most efficient and effective stress effect reduction method. What is that? Stress effect. So we're not reducing your stress necessarily. We're not reducing the trouble in your life, but the effect it has on your body. We're teaching you how to protect these buttons in your brain by coming in the back door with this super powerful technique. Heart math is what she's going to teach you. Heart math is kind of like the formula for getting your heart to work right, and the heart then informs the brain. It bypasses the logical brain. So we talked about the logical brain, that front part. It's going to bypass that, and as you repeat it, it lays down new pathways, so you become better at doing this. It becomes more natural and simple. All right, take it away, Anna.
Okay, so when you are stressed, your body is out of sync. Negative emotions we feel when we're stressed, such as anger, frustration, anxiety, and worry, lead to increased disorder in the heart rhythms and the nervous system. And I'm going to...
Yep, you're good. I just want to make sure the mic was on.
And I'm going to show you a way to manage that. It's called the quick coherence technique. The quick coherence technique is an easy way to interrupt the stress responses and quickly bring your system into coherence. You can practice this tool anytime during the day. The time that I practice it is on my way home from work, so that I can do my breathing.
Are you saying work is... I'm just kidding.
Work is not stressful at all. So I will use this on my way home because I want to leave work at work. I mean, who wants to take work home with them, right? I'm just going to leave it here. But you can use this anytime you want to rebalance or get an energy boost. And I'm going to share a story with you of a patient that learned this technique here in the office, and she used it at home. So she has a 2-year-old who is very, very active. She said that one day she was home and this child was just all over the place, and she just so stressed out, didn't know what to do, and she remembered the techniques that she learned here. So she stepped into another room, did this technique, came back out, and she felt less stressed, and she also noticed that her child was a little bit calmer. So the way she did that is she did her breathing, and when she came back out, she radiated that feeling that she had onto her child, and so they were both having a better day.
Awesome.
Okay, so here it is. Here are the steps. You're going to focus the attention in the area of the heart. Imagine you are breathing into your heart or chest area a little slower and deeper than usual. The suggestion is about,
right now?
Yeah, so it's about 5 seconds to inhale and 5 seconds to exhale, or whatever rhythm is comfortable for you. And step 2, you're going to make a sincere attempt to experience a regenerative feeling such as appreciation or care for someone or something in your life. So think of something positive in your life. Now we're going to move on to the heart lock-in. Step 1, you're going to focus your attention in the area of the heart. Imagine you are breathing in through your chest or heart area. Again, taking about 5 seconds to inhale, 5 seconds to exhale. Activate and sustain a regenerative feeling such as appreciation or care or compassion. So you're going to hold that thought in. Now you're going to radiate that renewing feeling to yourself and others. This benefits them, and it helps you recharge and balance your own system. And just like the patient I just mentioned, that's what she did. She did these techniques, came back out. Her child felt the difference. He was acting different. So, win-win.
All right. Thanks, Hannah. Okay. I'll take that. So what is the most... Put this microphone away. Yeah. What's the most efficient and effective treatment? So that was a way to get in the back door. And the reason let's come back to that for a moment. Although this cognitive behavioral therapy is similar, but not exactly. So these deep areas in the brain, these emotional centers of the brain, that's by experiencing the emotion, feeling the emotion, allowing yourself to feel that and not just think, oh, I think that's not an idea. That's not enough. You actually have to experience the emotion. That has a powerful physiological effect in your body, okay? It activates these areas of your brain, the limbic areas, and then they start informing your cognitive or your thinking brain, the orbitofrontal and dorsolateral prefrontal. It informs those. It says, hey, you should be thinking good things. And then it makes it, you're like, oh, well, actually, I was already trying to think good things, so thank you for making it easier. It makes those good nerve pathways easier to go along. As opposed if you've got these negative suggestions from deep in your brain and you're trying to go, no, don't think that, no, don't think that, don't think that. I'm just gonna relax, right? You can see how this is super cool. It is super simple. Like Anna taught you 2 techniques. One of them built on the other one. That's it. There are a little bit more to it, and we'll teach you things in the office. But that's how simple it is and super powerful. So that's your So appreciate it, even though it's super simple. It is super powerful. Okay. Then we go to physical. Let me make this bigger. Okay. Wow, you got to see my face up close to me. So, yeah, the most efficient and effective treatment physically. They did some research. This, I'll show you what this is. This came out in 2024. And let me put the screen up so you can see all of this. Okay, and I'll let you come back to the details in a minute. So they had 14,000 participants in these studies. Different forms of exercise compared with other common treatments for depression. All results are presented as compared with active controls. What are active controls? That would be common treatments for depression, right? So what we have here is the peach is equivalent to active control. SSRIs, selective serotonin reuptake inhibitors with the medications. That there are 432 participants on that. Barely improvement at all, right? So clinically important benefit was right here. So yeah, it actually shows some benefit, but not very much, right, for the most common treatment. We talked about those lines. Walking or jogging was the best. Well, that's pretty cool. Walking or jogging showed a really significant improvement. This down here, the line. Dance was best. Really? Dance is even better than walking or jogging. But in this case, they noted that this was mostly young females who were in that group. So they can't say this works for everybody. But if you're a young female, dancing is most likely to be most effective for you. What kind of dancing? I don't know. But make sure it's healthy dancing. Yoga was pretty good. Cognitive behavioral therapy, what is that? That's a type of mental therapy where you do a lot of what we're talking about today. You learn about the brain, you learn how it works, and then you learn how to identify emotions, and then you basically put them in their place. It's actually a really good, effective therapy, well tested. Not quite as good as walking and jogging, interestingly, but as good as yoga. Exercise and medications was actually pretty good. It's like, well, why not just exercise, right? And just skip the medication, because walking or jogging is even better than exercise plus medications. Seems like medication made it worse compared to just exercise. It could have been something else in the data there, but mixed aerobic exercise, interestingly, that was worse. It's still a lot better than medication, but it was worse than just walking or jogging. I don't know. Just the facts, all I can tell you here. This is more about the physical. In this case, we're talking about subluxations. Let me raise this screen camera. Oh, you were able to see it. Subluxation and nerve irritation. So what are we talking about here? So this is the brain, the spinal cord that sends nerves out to your organs, and then those nerves send information back up to your brain. Also, all around the spine, there are nerve receptors, and especially in the muscles and the joints, and that sends signals to the brain all the time, activated by gravity, activated by motion of the body, not necessarily the organ, but of the body. The spine is way more dense than any other area in the body for nerve receptors, especially when we get up to the upper cervical. So what is a subluxation? This is normal. We just talked about that normal function of the nervous system. A subluxation is a spinal joint dysfunction that causes nerve interference. It is a form of stress. Mental, chemical, and physical contribute to subluxations, which is a disruption in that communication. It's a disruption first in the joints, but that immediately then causes a disruption in communication between the body and the brain. When we do a spinal adjustment, the first one especially, will have patients identify how do you feel before and then what do you notice after. And they can feel the changes in their nerve function. They often feel lighter, they feel looser, and super cool. They can feel how their nervous system is supposed to work. Why nerve interference matters? Because the purpose of the nervous system is to enable you to adapt to stress, which is the causes of all these problems. Mental, chemical, and physical stress. That's what the nervous system does. And if you interfere with its function, you can see that. Caused by physical, chemical, mental. It's defined as a spinal joint problem causing a nerve problem or irritation. This is what subluxations are. It's initially is silent, but then it leads to symptoms and conditions. And subluxations are corrected by chiropractic spinal adjustments. So this is the physical, another physical component, and how we correct it. I'm going to tell you a story now. It's an autism stress story. This one is about Ratramel. So young boy, immediately calm after his adjustment. So this young man comes in, he has autism, and pretty squirmy, pretty agitated often will be the term. And when he gets an adjustment, he immediately feels, we can see it, parents can see it, I can see it, and he changes. It's pretty cool. It's almost like he melts right there. It's beautiful to see his nervous system calm. You can see his brain is just comfortable again. And we want to keep him there all the time. And as time goes on, he's there more and more often, and we love that. So as we change this physical, it immediately has a neurological effect that then has a change in his cognitive or mental approach. Another patient, he wasn't able to drive to his treatment, or wasn't able to drive to work. He had anxiety, and it was really affecting his life in a really powerful way. And we did treatment. We did a whole host of different treatment, but part of it was chiropractic adjustments, and he became more and more able to engage his brain in ways that he was in control. If we think about that brain picture again, it was no longer those more foundational, the limbic area that was making his brain do what it wanted to do. He could think and go, hey, this is what I want to choose to do. I'm not going to choose to let anxiety control me. And I know when it's bad, it's not a choice. It is controlling you. But now, and we know this normally, right? You should be able to go, no, that's not so bad. I'm just going to go forward. And this is what he'd tell me. He'd go, work was really stressful. This has been really stressful lately, and that's okay. He's like, I can handle it. Before, I couldn't. It's like it was really stressful, and it was overwhelming. Now it's really stressful, and so his brain now works properly. He can put things in their place and move forward in the way he's supposed to. So what are some action steps you can take? We think physically, spinal hygiene. So I'm going to teach you some spinal hygiene right now. All right. So what do you do? Two simple things. All right. We'll just teach you two simple things. One is range of motion. So every morning you can do this. The range of motion is moving each area of your spine through its full range, each direction. First one will be going to the sides. Tilt your head all the way to one side, and then you tilt your body. I'm going to be disappearing. All right, but you keep your head tilted as well. And you hold it for about 10 seconds in that full lateral flexion of your neck and back. And then you go to the other side. So you guys do this with me. Don't just make me look funny. All right, do it with me. To the side. Hold it for 10 seconds. Okay, so that one, that's this plane. We're going to go in 3 planes. Now we're going to do rotation. I'm going to turn my back. Turn your head all the way. Then turn your body all the way. And so you should be looking around backwards. My feet are still pointing that way. Okay? So keep that tension. Don't go into pain, but you want to keep the spine tense. So it's in its full range. Same thing the other way. And our last one is forward and backwards. So we do these, separate the neck and the back in these. So head all the way down. And then if you've done that in 10 seconds, then you go down and you bend forward. You're not going to be able to see this, but what I want you to do, I do want you to bend your knees on this. This is not a hamstring stretch. This is a spinal motion. So when you bend your knees, as much as you need to bend your spine all the way, okay? So it may be like a little bit of a squat instead of just bending to touch your toes. So you bend forward. All right, so you can't see me, so this is not helpful. And then you go backwards, head all the way up, And some people will put their hands behind their head, interlace their fingers, and then push against that, and that helps. If your neck hurts when you go backwards, that helps you get farther. Okay, and then you're going to bend backwards. You don't have to look backwards at the same time. You can just look forward, because some people get off balance. And they try to do both of those at the same time. All right, that's your spinal hygiene. Stress, emotional stress causes biochemical stress, which then causes instability in your biochemistry and your nervous system. Digestive system dysfunction. How does this? So it disrupts the balance of bacteria in the gut. So emotional stress leads to gut problems. Increased nutrient excretion. I'll let you guys look at this closely. So increased nutrient excretion. Chronic high cortisol, which just comes with stress, can lead to increased urinary excretion or release of magnesium, potassium, and calcium. So you lose nutrients. Altered metabolism. Chronic stress alters the priority of your body's energy needs, usually prioritizing burning sugar over burning fat. This is where you get the cortisol belly, right? So emotional stress also reduces good habits. We tend to eat more processed foods. We exercise less. We're less mindful, which means we're less aware of our bodies and doing the right things at the right time. We're less relaxed and less quality sleep. Emotional stress causes biochemical problems in our body, which leads to instability in our nervous system or makes it unstable. So we're more likely to have a brain that doesn't work right and not reacting to stress appropriately. Another success story, Karen Hayes, she just sent in her third testimonial to us today. I haven't read it yet. She had mental stress, which would cause neuropathy pain. Every time things would get really stressful, her feet would mess up. Her neuropathy pain would get worse. Well, life has still been quite stressful for her. All kinds of things going on, but she's had a lot less of that neuropathy pain, and she has to do a lot less home therapy to keep it well, because we now raised the health foundation within her body. She was devoted, committed to doing what she needed to do. Even before she got to us, she was doing all kinds of things. We just helped her do more of the right things so she could spend less time on it and get more results. Chemically, what is the best eating plan? This is going to be awesome. All right, what's best? The MIND diet is best for almost everybody. What's on the MIND diet? I'm going to go through this quickly, but you can come back to this later if you want to look more on this. At least 3 servings of whole grains each day. I actually don't do that part. I eat very few grains, but this is what's on the MIND diet, and so it's appropriate. If they're healthy grains and you don't have a sensitivity to these grains, then it can be good, because there's a lot of good nutrients in whole grains. Eat at least 1 dark green salad and 1 other vegetable each day. Berries at least twice a week. Eat at least 1 ounce servings of nuts each day. Beans or legumes at least every other day. Poultry at least twice a week. Fish at least once a week. No more than a tablespoon of butter or margarine. Choose olive oil instead. And cheese, fried food, fast food, no more than once a week. Pastry sweets less than 5 times a week. That's actually quite a bit. I'd say once a week on that. You can have a dessert that's in that sweets category. That's pretty much it. It's pretty simple. It's pretty basic. You can organize that in a lot of different ways for yourself, but that's it. That's the MIND diet. A couple modifiers that I would put on it: gluten-free. Eat the gluten-free grains. You're more likely to do well, because so many people have trouble with gluten. Not everybody does. There's a test we can run to see if you have a problem with it, but unless you know, it's probably a good idea to stay away from it. Free-range organic beef. So yeah, beef is good if it's free-range and organic. It's super expensive. I actually buy a whole steer at a time, put it in our freezer, so that's what we eat a lot of that. But also free-range and organic, the chickens, right, and the other not farmed fish. So those are better choices. They're not critical in the diet to get a lot of results, but they're going to even make it better. Wild versus farmed. Yeah, we just talked about that. And organic grass-fed dairy. You're going to be a lot better off if you get from the grass-fed and organic. And then we said ultra-processed foods 1 to 2 times a week. What's the best eating schedule? So that was the diet. And what about the schedule? New research just came out in 2025. They talked about time restricted eating. This is a lot of people are doing this these days. Right? This modified fast or time restricted eating, TRE. If you did an 8-hour window, 12 weeks. This is the study they did. They went for 12 weeks, and there's different types. There's variable, which means you get to choose whether it's you restrict your eating early or you restrict it late. And then there was another category we'll talk about, which was not restricting at all. Right? So there's variable, early, and late. With the variable, we'll get the title in here. Weight, the hip and waist ratios. If you take a tape measure, measure your waist around your belly button, and measure your hips. Where did you lose? Generally, it's going to be fat. Where did you lose the fat? And those are pretty. Weight, hip and waist, I think is more important than the. Sorry, I'm getting a phone call now. Okay, so the hip and waist are more important than the weight, even though that's what they measure. Now, if you're looking at body composition or body fat, that's going to be better. But this is what we got. So 3.9% weight loss. So variable was the most at this point. 3.5% loss, 3.5, and 1.5. Not so restricting your calories to an 8-hour window was actually quite helpful at reducing weight. And the hip and waist ratio, hip and waist measurements, those were better with early and late. So we know we're learning this with Wegovy and Ozempic and the other semaglutide medications. 40% of the weight loss is lean body mass. What is that? That's muscle and bone. Some are saying, well, maybe you don't need that much muscle and bone if you lose all that weight. Yeah, I don't buy it. 40% loss of that stuff that's burning calories, I think these people needed it. Anyway, so weight is not always a good measurement, but these physical measurements are actually, I think, quite good. So early and late, either one of those worked pretty well. And although the late was, I think that one was a little bit better, but they're both pretty good. So, and then at 12 months, so how did people do? Not only did the program for 12 weeks, but at 12 months, they checked them again, and they weren't telling you have to do this. But of course, when you see results, you're going to be more likely to do stuff. So what did they do? Well, the variable, they actually did okay, whether they get to choose whether it's late or early, whatever they want, but they restricted for those 12 weeks. The early and late, people who are more disciplined, this is what you need to do. When they went off of the study but continued to be evaluated, they had a 2% weight loss, and the people who didn't have any restriction, at 12 months they actually had a weight gain. So not so good for them. So choosing early or late is quite good, and they're both pretty similar. And I would choose those as the ideal ones, although variable is not bad. So do the right diet, the right time, you can get some great results. Chemical inflammation, infection, autoimmunity, find and address deficiency, toxicity, sensitivities, gut health. This is functional medicine. This is what we do. This is an example of one of the lab tests we run to look for nutritional deficiencies. We can find a lot of things, and this can help your brain health, which then helps you manage stress better if your brain is properly nourished. It's a lot like a muscle. It needs to be properly nourished. It needs to be exercised. And if it has those things, then it's going to be much more likely to be able to handle the stress that it's put under, right? That's going to help you manage stress. 2-minute questionnaire, self-help summary. Really, this, you can come back and look at this later. I won't go through all this, but it basically goes through everything that we went through. It goes through the mind, diet, and the mental and the physical. It's a way to assess yourself. In the next screen or two, I'll show you the scoring for it, but you can go through and fill those out on your own. Another piece of paper, fill this out. You can see that closely, and then see how you score. If you score 35 to 22, you're actually doing pretty well. Right? You start getting less than that, you're maintaining, then you're slipping, and then you're wasting away. That's really bad. And this was developed I developed it based on all this research. Really, we're thinking about mind health, brain health, and mind health. And mind health, we're thinking about dementia. But stress, anxiety, depression, this is brain health and mind health as well. And it's addressing how you move, sleep, think, breathe, drink, and eat. This is another summary. It's a lot like that questionnaire, but now it's just saying, okay, just do this. Right? This is the things you should do to have a healthy brain, to be able to manage stress better. Again, a lot of the things we'd already covered, but just in a summary form. Get a picture of that. And I have actually developed a program for tinnitus. It's tinnitussynergy.com. And the Healthy Brain program that actually walks you through this, gives you a questionnaire, and then gives you instructions basically on implementing each of these steps, and some cognitive behavioral therapy and all kinds of cool stuff on there. I'll tell you this too. It actually, there's part of the Healthy Brain program. There's a sleep program, sleep hygiene, the healthy eating program, with the mind diet, etc. So step-by-step implementation, so you can do it one little bites at a time. No pun intended. Traditional medical doctors rarely mention solutions other than drugs and surgery. Does this mean they're bad? It does not mean they're bad. It just means they're focused on infection, disease, trauma, and tumors. If you don't have one of those, they're like, well, I don't know what to do for you. And it takes a lot of work. Every once in a while I think about how many things I didn't learn that medical doctors have to learn about drugs and surgeries. There's a lot to know. And so for them to also look at nutrition and wellness and musculoskeletal, there's just like, you just can't know everything. So they focus on this because that's what most people want. Actually, give me a pill or give me a surgery to fix me now, because I don't want to do anything. I want you to do things. That's why you get paid. You're the doctor. Fix me. Right? So patients who come to us recognize this is a team sport, and your life is your choice. Natural solutions require holistic evaluation, and so that's why we do a very thorough evaluation to find the right combination for your health, looking at physical, chemical, and neurological, mental, emotional. 7 synergistic steps. Find the cause. That's where our evaluation is. Decrease dietary interferences. Increase dietary healers. Let's take away foods you might be sensitive to. Increase foods that are healthy, like in the mind diet. Restore body neurology and structure. We do that through adjustments and different exercises you may do at home or we may do in the office. We might also use laser, the therapeutic red light laser or violet laser, to activate the brain, help increase energy in the cells, decrease inflammation, promote healing. Move and use your body correctly. This is exercise. We teach you what to do, but just move, right? Just move. That's a start. And then reevaluate. So we do reevaluations because we want to know, are we still focused on what you're focused on? And are you doing what you're supposed to do? How well is your body responding? Is there something else we need to do to make this go better or faster? Our evaluation has several parts. And this is a stress solution, looking at this whole picture. So we sit down, we take a history, and then we do a spinal and nervous system screening. After the history basically is us having a conversation. You fill out questionnaires, and then we talk, and you share what's important. You really want us to know, and then we ask questions about things that we really need to know. All right, and then spinal motion palpation, that's where I use my hands to feel the spine, but we also use some technology to scan the spine and see what's going on there. This is normal, this is abnormal. All right, this is the activation of the nerves and muscles along the spine. We want to see it, these bars like this, and yeah, these other colors are not normal. White is normal. Part 2, structural and neurological testing. Do a lot of different neurological testing. Autonomic nervous system, it's called heart rate variability. That one's pretty cool because that determines actually how well is your body adapting to stress. How much reserve does it have to adapt to stress? That gets right to this, your capacity to handle stress. It's a great test. Very simple, but very effective. We also might check your feet, digital analysis of your feet. We'll take x-ray if necessary to see all the structure, how's it working. This is somebody who's got trauma doing neurological testing. Eye movements are really important. So it's a very sensitive way of measuring nervous system function. And 3 and 4, to finish it up, results report. We'll sit down and we'll go over all these results with you and tell you what we found and what you need to know and what to do about it. And then we'll do a therapeutic trial, which is an adjustment or some other therapy to see how well your body responds. And functional lab testing, that we do a little bit later to see if you have deficiencies, toxicities, gut health problems, etc., and restore that function. That's a really important part for most people dealing with systemic issues, and stress management is a systemic issue. And for this evaluation, typically it's $275. There's a seminar price, which is here, all right, $105. So a major reduction. If you mention this video to right now, it is June 5th, 2025. So before we'll give you a week, June 12th, 2025. If you mention this stress solution exam price, then we'll give that to you, right? And then we'll get this full evaluation in the report for that single price. This just goes over that lab test again. That's the lab testing is separate from that, right? So it would not be included in that. All right, that's it. I hope you enjoy this. Please take at least one thing from this and apply it this week so you can start seeing changes in your life right away. All right, have a wonderful day, and may God bless you.